Good morning. Today we are going to discuss the commonly used instruments in rhinology. So this topic is directed towards the curriculum needs of undergraduate students in medicine. So this topic will be discussing. We will detail only the commonly asked instruments in practical examination as far as undergraduate curriculum is concerned. So the two common surgical procedures that the undergraduate student is expected to know happens to be the septoplasty, SMR, and then endoscopic sinus surgery. These are the common nasal surgeries which undergraduate student is expected to have a basic idea of. Now we will be seeing all the common instruments which we use in nasal surgeries, and not forgetting the commonly faced trauma, that is fracture nasal bone. So those instruments also will be shown here and discussed here. Now let us go to the first instrument, which happens to be the Killian's long bladed nasal speculum. So as you see, this blade is virtually long, and you hold it as you hold a Tudikum's nasal speculum by hooking the shoulder of the speculum by stabilizing the left prong with your ring finger and manipulating the right prong using your index finger. This is how you do it. So this instrument has a unique advantage of passing deep into the nasal cavity. Of course, in an awake patient, this could cause a lot of discomfort. But if the patient has been anesthetized, whether locally or under general anesthesia, this is not going to be a problem. So at the outset, I wish to point out that this instrument should be used only after either topically anesthetizing the nasal mucosa using 4% xylocaine, or after administering general anesthesia to the patient. And the nasal packing is ideally done using two important instruments, that is Tudikum nasal speculum to hold the ala apart, and then using the Tilly's nasal dressing forceps. This forceps goes by the name Tilly's nasal dressing forceps. So this forceps has a unique curvature, and this curvature helps the surgeon to insert cotton pledgets inside the nasal cavity without any obstruction in view. So whenever you are trying to insert something into the nasal cavity like a medicated gauze, the tip will always be visible. So this is the Tilly's nasal dressing forceps. So this forceps is very important component for all nasal surgeries. I repeat again, this is the most important component or most important instrument for all the nasal surgeries. You can use it to pack the nose, you can use it to remove the pack, you can use it to remove the small bits of cartilage and bone which you have sectioned from the nasal septum. All these things are possible using this Tilly's nasal dressing forceps. Again, I repeat again, this is called Tilly's nasal dressing forceps. So Tudikum's nasal speculum I have already covered in my previous video lecture on instrument used in ENT OPD. So that is again available in my YouTube channel. The next instrument I am going to show you is the self-retaining Killian speculum. The major advantage of this speculum is, as the same thing like this is a normal Killian's nasal speculum, but this speculum has a unique advantage in that it can retain its width. So you just by tightening the screw, the distance between these two horizontal prongs increases. By loosening the screw, it will decrease. So you can insert this speculum inside the nasal cavity, and by simply tightening the screw, you can widen the distance between the nasal septum and the lateral nasal wall, thereby increasing the space for manipulation by the surgeon. So this speculum is a unique tool in all septal surgeries. So this is known as Killian self-retaining nasal speculum. So this speculum allows both hands of the surgeon to be free during the surgery. So again, this instrument is very vital. It is called Killian's self-retaining nasal speculum. So again, I repeat again, you can come by bringing the handle close together, you can open up the mouth of the speculum, and then you can hold the mouth of the speculum in the place by tightening the screw provided. So the moment the screw is tightened, the mouth of the nasal speculum stays open. Mouth of the nasal speculum stays open. So supposing you want to close the mouth of the nasal speculum, you just unscrew it, the nasal speculum, Killian's self-retaining nasal speculum will close on its own. So now we have seen two different types of Killian's nasal speculum. One is the ordinary Killian's nasal speculum. The other one is the Killian's self-retaining nasal speculum. The next instrument I am going to show you is a Freier's elevator. This is known as the Freier's elevator. This elevator is held in your dominant hand and it is used to separate the mucoperiosteum from the cartilage. So this Freier's septal elevator, this is known as a Freier's septal elevator. It has a slight modification. You see a small suction port here, so you can attach your suction tube here, so that when you attempt to separate the mucoperiosteal lining from the cartilage, any bleed that occurs will be obstructing your vision. So it will be automatically sucked via this small opening which you see. I think you should be able to appreciate now. So this is the small opening through which the secretions and bleeding will be sucked into the cavity which is there inside this elevator. So this elevator is used for elevating the mucoperichondrial lining from that of the cartilaginous portion of the nasal septum. This is a very important step in all septal surgeries. The next instrument I am going to show you is a unique instrument which is known as Ballanger's swivel knife. It is again, I repeat again, this is known as Ballanger's swivel knife. As you see the curvature straight here, it takes an angled curve and then it becomes straight. So this curvature really helps you when you are doing nasal surgery, because the tip will always be visible. The tip will always be visible to the surgeon. And now why this name swivel comes is, you see a small blade at the tip. I think you should be able to, I will take the blade out and show you. So here you see the blade. This is actually the blade which rotates 360 degrees. So the blade in Ballanger's swivel knife has a tendency to rotate 360 degrees. I will rotate and show it to you. So the blade rotates. You see it is rotating. So now by holding it like this, you make a small incision after you have elevated the mucoperichondrial covering of the nasal septal cartilage. You on either side, both sides it should be elevated. You make a small incision over the cartilage and then you hold the Ballanger's swivel knife so that the sharp portion of the knife will be sitting on the incised portion of the cartilage. You just cut like this. As soon as you touch the bone, that is the perpendicular plate of the ethmoid, you bring it down. As soon as you bring it down, the blade, swivel blade, automatically swivels in another direction, that is vertical 90 degrees, and cuts the vertical portion of the quadrangular cartilage of the nasal septum. And then after you brought it down, after you have touched the maxillary crest, you pull it out. The moment you pull it out, what happens is this blade again turns itself in such a way that it will start cutting the undersurface. It will start cutting the undersurface of the quadrangular cartilage. So you get completely excise the quadrangular cartilage precisely by using this versatile instrument known as a Belanger's swivel knife. So this knife, this is how you use it. You push it, cut the cartilage like this, and then moment you hitch the perpendicular plate of the head mat, you bring it down and then pull it out. So this is the moment. So when you do it, the cartilage will be totally separated, and you can use this forceps known as a lux forceps. This is again a commonly used instrument in otolaryngology. Here this has multiple uses, but one of the use is in the septal surgery, where you can remove the remnants of the bone, remnants of the cartilage which is left within the nasal cavity after you have done all the cutting. So here you use this lux forceps, you hold the cartilage and then pull it out. So that is one way of doing it. On the other hand, again I would like to stress another important use of this lux forceps. I've told you already that this instrument is highly versatile instrument. This is again a commonly displayed instrument in your practical examination. So you see the lux forceps again can be used to take tissue biopsy. It can be used to take tissue biopsy either from the malignant lesion, the suspected malignant lesion of the oral cavity, nasal cavity, anywhere in the head and neck region. You can take a biopsy using this lux forceps. You can see the edges of the lips are pretty sharp. The edges of the lips are pretty sharp, but there is a cavity here. So you see a cavity here, a corresponding hole here. So why this hole is there? So when you hold a tissue, when you cut the tissue will be held within this hole. The tissue will be held within this hole, so there won't be any trauma to the tissue. So that lux forceps is not going to crush the tissue. It will just cut the edges and remove the tissue en masse. So the advantage of this is when you send a specimen to the pathologist, if you crush the tissue, they will report it as a crush artifact. So they may not be able to interpret the tissue finding when you crush the tissue. So lux forceps is a unique feature of having a hole between its lips, so that there is virtually no chance of creating a crush artifact. On the other hand, the sharp lips really cuts the tissue clean. Again, look at this curvature. This curvature is really unique because it does not cause any obstruction to the vision while you attempt to do the biopsy. The next instrument I am going to display is the mallet. So this mallet is useful in removing the bony deviation, bony crest seen in the nasal septum. So whenever there is a bony deviation involving the floor of the nasal cavity, you use these various types of gouges. So multiple types of gouges are there, and this is the commonly I prefer to use this gouge. Maybe this may not be kept in your exam, but I'm just giving it for completion's sake. So this gouge can be used to take away the bone from the floor of the nasal cavity. Whenever there is acute angulation of the maxillary crest, you can remove the maxillary crest by placing this lip in the crest and hitting the gouge with your hammer. So this is how you do it. And then the next instrument I am going to show you is a raspitory. So this raspitory again is very useful in rhinoplasty surgery, where you can hold it and smoothen the cartilage and bone. Again, in septal surgeries, if you are working on the floor of the nasal cavity, if you find there is a minor bump or hump, the bone can be just rubbed with this sharp surface. It's like you get a close-up view of the roughness. It looks more or less like a sandpaper. So you use it to rub and smoothen the bony deviated portion so that it becomes literally straight. The next we will see some of the instruments which we see when we do a reduction, close reduction of the fractured nasal bone. So here the two important instruments which you are supposed to use when you attempt to reduce a fractured nasal bone this is the ash forceps. This ash forceps is used to refracture and reposition the nasal bone. So you hold the Ash forceps, Welsham forceps. This is Welsham forceps. The Welsham forceps, I repeat again, Welsham forceps is used to reposition or refracture the nasal bone, fractured nasal bone. So all the cases which come with fractured nasal bone would have undergone a certain amount of healing in an abnormal way. When the patient comes to you, they will be around 6 or 7 days old. So in these cases, callus formation would have taken place and the bone would have started uniting in a unaligned manner. So you need to refracture and reposition the fractured nasal bone, and the forceps which you use to do this refracturing and repositioning is this Welsham forceps. So this Welsham forceps you hold in your non-dominant hand, in the dominant hand if you prefer. So you use your dominant hand, put this slip should go inside the nasal cavity underneath the nasal bone, and this goes over the skin covering the nasal bone. You hold it and then open up the bone as you open up a book. So this is the way to out fracture the nasal bone. As soon as you out fracture the nasal bone, you will hear a small click and a give way. So you go to the head end and then knead the bone back in place, and then to the other side you turn the instrument to this side so that always the smaller lip gets underneath the nasal bone and the larger lip is over the skin lining the nasal bone. Should be inserted the nasal cavity in such a way that the smaller one gets underneath the nasal bone and the larger one sits outside over the skin lining the nasal bone. So again you similarly out fracture the nasal bone as if you would open the book, go to the head end, knead it back in position. But all cases of fracture nasal bone is also associated with fracture of nasal septum. So you need to reposition the nasal septum. If you fail to reposition the nasal septum, what happens is the nose always looks crooked and heals in a crooked manner. So for that repositioning of the nasal septum, you use this forceps known as Ash forceps. This Ash forceps is known as the Ash septal forceps, where you insert it between the nasal septum, lift the nasal septum up and reposition it. So the first step you do is you out fracture both the nasal bones using Welsham forceps. So you open up the nasal bones like a book. The book is open, and then next what you do is you use this Ash forceps to lift the buccal nasal septum upwards so that it will fill the spine of the book. It should fill the spine of the book. Then you go to the head end and knead the nasal bone back in place. So that is the use of these two unique instruments. One is the forceps which you use to refracture or reposition the nasal bone, that is the Welsham forceps, and this is the forceps which you use to lift up and repositioning the nasal septum, and this is known as Ash forceps. The next instrument I am going to show you is Miles retrograde gouge. Miles retrograde gouge. Here you see, this is how it will look like. I am turning it and showing you the entire instrument in its totality. This instrument is used to perform inferior meatal antrostomy. This is used to perform inferior meatal antrostomy. So you hold the Miles retrograde gouge like this. So when you use your right hand, you do the antrostomy on the left nasal cavity of the patient. So you push the Miles retrograde gouge into the floor of the nasal cavity, and then you hold your finger like this, so that this is your guard and measurement. So the moment your curved tip of the Miles retrograde gouge touches the lateral nasal wall, you just turn it inwards. It will perforate the most brittle portion of the inferior meatus, and then while you remove it, the small bit of bone will come out through this groove, it will be held in this groove and it will come out. Then similarly, when you want to do it on the right nasal cavity of the patient, you use your left hand and then the same way you guard it using your index finger, push this gooch along the floor of the nasal cavity, and as soon as you feel that you have reached the lateral nasal wall, just turn it laterally. It will perforate the inferior meatus, causing the opening in the inferior meatus. So initially these surgeries were performed to facilitate gravity dependent drainage of the maxillary sinus. After the advent of endoscopic sinus surgery, this instrument is very rarely being used these days, but still for the sake of completion I am demonstrating this instrument. So another instrument, this is actually the commonly used instrument in endoscopic sinus surgery. This is the straight Blakeslee forceps. This is the straight Blakeslee forceps. This is again a common instrument that will be displayed in your practical exam. This is actually the bulwarker of all endoscopic sinus surgery. So you see this instrument, Blakeslee's forceps, can be used to remove the cut mucosa, cut ethmoidal air cells from the nasal cavity. This can be used to crush and remove the concha. So this is actually a versatile tool which endoscopic sinus surgeons really use. Another instrument is 45 degrees Blakeslee forceps. Here you see the tip is turned 45 degrees. So here this forceps is useful while you attempt to widen the frontal sinus ostium, while you attempt to access the various recesses of ethmoid air cells. So this is actually a 45 degree angled Blakeslee forceps. This is a 45 degree angled Blakeslee forceps. These two forceps are commonly used in endoscopic sinus surgeries. Another instrument I am going to display is a ball probe. So you see a ball probe on either side, various sides. This probe really helps you to identify the various sinus ostia. So this probe, ball probe, will be helpful in identifying atraumatically. It just gets into the sinus through its natural ostium. Atraumatically, you can probe the sinus ostium. You can remove the minor mucosal obstruction which obstructs the drainage of the sinus using this ball probe. So this ball probe can also be used to enlarge the natural ostia of the frontal sinus as well as the maxillary sinus. So ball probe is again a common instrument which is used in endoscopic sinus surgery. So another instrument I am going to show you is the endoscope vessel. This is actually a nasal endoscope. I'm going to show you. Let me take it out. So this is actually the nasal endoscope. This is a 4 mm nasal endoscope. So I am removing the cap. So this is the tip which goes into the nasal cavity. It contains a series of rod lenses. The entire sheet contains number of lenses. You attach the light cable here so that the distal end of the endoscope will be illuminated, and here you see the eyepiece. You can attach the camera to the eyepiece and the entire nasal cavity can be viewed from a TV monitor. So you attach a camera here and then you attach the light cable here. The light comes from the xenon or halogen light source, and then you screw the cable here. So the light from the light cable will get into the prism here. Here is a prism, and then all the light will pass through a series of lenses here and it will come out through the tip. So this rod lens system transmits light as well as it helps the surgeon to visualize the interior of the nasal cavity. So it's a very important instrument. This has revolutionized the nasal concept of nasal surgery. So this is an endoscope. It is available in various angles. The commonly used angle for surgery is a 0 degree. You have the 30 degree and you have the 70 degree. These degrees indicate the width at which the visibility is possible. If you, the more the angulation, the wider is its width. So if you want to look into various crevices on the lateral nasal wall, you can use either a 30 degree or a 45 degrees. And if you want to work on the frontal sinus ostium, you use a 70 degree nasal endoscope. Mind you, the diameter of the scope is 4 millimeters. All nasal endoscopes are 4 millimeters in diameter. Repeat again, all nasal endoscopes are 4 millimeters in diameter. Thank you very much for your patient listening.